This is Wendy McIntyre. This is my Nursing 612 physical exam video. This is my patient. I've observed her as she entered the room. Her gait was steady without any difficulty. She's dressed appropriately, she's well groomed, and she's conversational and answers questions appropriately. She is alert and oriented ×4. Prior to coming into the room, we've checked her vital signs, including her height and her weight, her distance vision using the Snellen chart, and her NUR vision using the Rosenberg chart. I've asked her to empty her bladder, remove her clothing, and put on a gown for our physical exam. I've washed my hands, and now we're ready to begin. Her skin is pink. There are no lesions or edema noted. Hair distribution is even. Her skin is warm, and she has good turgor. Her head is normocephalic. Scalp is easily movable. No lesions or edema masses noted there. Hair is soft with good texture. Her face is symmetrical. And I'm going to palpate the bones of your face. Can you tell me if you feel any tenderness with that? Can I have you open your jaw, close your jaw, and can you open your jaw and put it side to side? And can you thrust it forward and then bring it back? Did you have any pain with that? No popping or clicking noted with temporomandibular joint. All right, and having you look straight at me here. Can you raise your eyebrows and squint your eyes shut? And can you smile and frown and stick your tongue out and clench your teeth? Okay, now can you close your eyes for me? Okay, tell me if you feel sharp or dull. Oh, tell me where you feel this.
Forehead, cheek, chin, forehead, cheek.
Okay, can you tell me if you feel sharp or dull now?
Sharp, dull, sharp, dull, sharp, dull, sharp, sharp.
Okay, so that exhibits that cranial nerves 5, 7, and 12 are grossly intact. So moving on to her eyes, her eyebrows extend to the outer canvas. Her eyebrows are full, hair distribution is even, there are no lesions noted. There are no dark circles under her eyes. Her eyelids have no edema. Her eyelashes are growing normally, they're growing upward and outward, no entropion or ectropion noted. Can you close your eyes for me? I'm just going to palpate her eyes. And there are no nodules, no excess tearing by the lacrimal gland. And can I have you look up? Okay, her sclera is non-icteric. I'm going to go ahead and look. Conjunctiva is pink and moist with no lesions noted bilaterally. Okay, I'm going to do a couple vision tests here. So if you don't mind, can I have you look at the back wall? And then look here at my pen. And then look at the back wall. And then look here. Her eyes are accommodated equally. They're round, 3 millimeters. And now can I have you look at that point over there and cover one eye. And remove that cover. Now cover the other eye. All right, and there are no extraocular eye movements, no strabismuses noted. So I'm just going to check. Don't keep looking at me, thank you. And they are reactive bilaterally and equal to direct and consensual light. So now if you don't mind, can you follow my pen with just your eyes? Eyes move smoothly through the 6 cardinal fields of gaze. Okay, so can I have you cover the same eye as me? And then tell me when you see my fingers.
Down, down,
Other eye.
down, down.
Good. Peripheral vision is intact bilaterally. That demonstrates that cranial nerves 3, 4, and 6 are grossly intact. So moving to her ears, if you don't mind, I'm just going to move your hair behind your ears. Her ears are symmetrical. They are set at the level of her eyes. There are no nodules noted. Can I palpate your ears? Okay. There are no nodules. Is there any tenderness with that? Does it hurt when I do that?
No.
Does it hurt when I do
No.
that? No? Okay. So I'm going to go ahead and check your hearing real fast, if you don't mind. Have you ever had any hearing problems? So I'm going to say a word, whisper a word, and I'd like you to repeat it.
Apple, orange.
All right, good. Now tell me which ear you hear this in.
Both.
Okay. Now we're going to check another one. Tell me when you no longer hear this.
No.
Tell me when you no longer hear this.
No.
Air conduction is longer than bone conduction by 3 seconds. Hair conduction longer than bone conduction bilaterally. Now I'm going to go ahead and take a look in your ears if that's okay. So the canal is pink, no excess serum and no lesions noted. The tympanic membrane is a pearly gray. There are no bulges noted. The bony landmarks are visible and there's a good cone of light. Okay, the canal is pink. There's no excess serum noted, no lesions noted. Tympanic membrane is pearly gray with a good cone of light. Bony landmarks are present, and there is no bulging noted. Okay. So moving on to your nose. Her nose is symmetrical, as are all the features of her face. It is all symmetrical. There are no lesions, no scars noted to her nose, no trauma noted to her nose. Can you cover one nair and breathe out the other, and then the other side? Both nares are patent. Can you close your eyes for me? What do you smell?
Peppermint.
And so that tests that olfactory nerve 1, the olfactory nerve, cranial nerve 1 is intact. And when we checked her hearing, that was her cranial nerve 8, her vestibular coccular. So both 1 and 8 are intact. Okay, and I'm going to go ahead and look in your nose if that's okay with you. So her nares are patent. There's no swelling. The turbinates are not enlarged. Septum is midline. No lesions are noted. Again for the other side. Nares patent. Septum is midline with no deviation. No, turbinates are not enlarged. No lesions noted. Okay, looking at her mouth is symmetrical. Her lips are full with no lesions noted. They're pink. They're moist. Can I look into your mouth? Is that okay? Can I have you say ah? So uvula rises to midline. Tonsils are visible but not enlarged. Hard and soft palate are intact, and again, there's no lesions noted. I'm just going to take this tongue depressor and look around in your mouth, okay? Okay. There are no lesions noted in the buccal mucosa in or around the tongue. Now, can you stick your tongue out for me? Can you put it back in and touch the roof of your mouth? And stick it out again and move it side to side. So that demonstrates that cranial nerves 9, 10, and 12 are grossly intact as well. So moving to her neck, I notice that her neck is symmetrical. There are no lesions noted. There does not appear to be any goiters or nodules in her thyroid area. The skin is pink. The even hair distribution throughout. I'm just going to palpate your carotid pulses, okay? 2+ and 2+ bilateral carotid pulses. And while I'm palpating, I'm going to look at your lymph nodes, looking at the preauricular, postauricular, occipital, tonsillar, submandibular, submental, the anterior cervical, posterior cervical, deep cervical. And can I have you put your hands like this? I'm looking at her subclavian. And there's no palpable lymphadenopathy in those areas. And while I'm doing lymph nodes, I'm going to do your axillary and epitrochular. No palpable lymph nodes there. Again, axillary and epitrochular. No palpable lymph nodes there. Can I have you swallow for me? So her thyroid has no nodules or goiters noted, and her trachea is midline. I'm going to go ahead and listen for bruits. No breweries noted in her carotids or her thyroid. Okay, if you don't mind, I'm going to have you turn around and I'm going to take a look at your back, okay? Move your hair. Skin on her back is even, it's pink, it's warm, hair distribution is equal. There's no lesions or masses noted. I'm just going to palpate around. Tell me if you feel any tenderness or pain, okay? Down your spine and all over the bony structures of your back. Any pain? Okay, so I'm going to go ahead and percuss down your spine. Let me just grab my pen and my, okay. I'm going to percuss between the intercostal spaces. Then I have good resonance in all the intercostal spaces. Okay, can I have you take a deep breath and hold it? Okay, can I have you take a deep breath? You can expel that. Take a couple normal breaths. And if you can take a deep breath, expel it and hold that. Okay, and I'm putting a mark there. And I'm going to measure that. Excursion is 3. Diaphragmatic excursion is 3 centimeters. So I'm going to go to the other side. Again, can I have you take a couple normal breaths? Okay, and then take a deep breath and hold it. Percussing down to the bottom. Okay, and I'm putting a mark right there. And can I have you take a deep breath? Or can you go ahead and take a couple normal breaths? And then take a deep breath, expel it, and hold that. Pressing up. Okay, and putting a mark right there, measuring the 2 marks, 3 centimeters. So diaphragmatic excursion is equal bilaterally. Okay, so I'm going to go ahead and ask you to take a deep breath for me. Take a regular breath, and I can see symmetrical chest movement. She's not barrel chested. AP and 0 is that her AP and lateral dimensions are appropriate. Now I'm going to have you say 99. 99. Tactile fremitus is equal bilaterally. So I'm going to have you take some breaths every time you feel my stethoscope touch you, okay? Deep breath. And again. And again. 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 And over to the side here 2 more times if you don't mind. Vesicular lung sounds heard throughout, and they're clear. No rhonchi, wheezes, or rails heard. And can I have you say 99? 99 is heard muffled, and that is a normal finding. So can I have you turn around to the front for me? Okay. Again, looking at her skin of her chest area, there are no lesions or wounds. There's no masses. I don't notice any pulsations or bulges. So I'm going to go ahead and palpate. Do you have any tenderness anywhere? Okay, no tenderness noted. I'm going to have you say 99.
99. 99.
Tactile fremitus is equal bilaterally without any difficulty. Okay, I'm going to ask you to do some breathing for me now, okay? Take some deep breaths every time you feel my stethoscope. Okay, and while I'm here, I'm going to switch, I'm going to listen to your heart as well. So I am listening at the aortic area, the second intercostal on the right, and then moving to pulmonic, second intercostal on the left, to Erb's point, the third intercostal, to the tricuspid, between the 4th and 5th intercostals, and to the mitral. Good, S1 and S2 heart sounds are normal, and the heart rate is regular. Breathing is regular and unlabored. Can I ask you to lay back now for me? Okay, I'm going to switch to the bell, and I'm going to listen for her heart sounds again to the 5 places, and I'm listening for a heart murmur this time. So I'm at the aortic, pulmonic, Erb's point, tricuspid, and mitral. And now I'm going to feel for the PMI, the point of maximum impulse, at the 5th intercostal space mid-subclavicular line. Good. Okay, and now I'm gonna go around to the other side and look at your abdomen, okay? All right, so just taking a look at her abdomen is flat, the skin is pink, the hair distribution is even, there's no scars noted, no masses, no nodules, I don't see any pulsations noted. So I'm going to go ahead and listen to her vowel sounds, auscultating vowel sounds in all 4 quads. Vowel sounds normal active in all 4 quadrants. And while I'm here, I'm going to feel for her aortic, aorta pulsation, which is normal. No abnormalities felt. And I'm going to go ahead and listen for bruits. No bruits. And I'm going to go to the renal arteries. And then the iliac arteries. And the femoral arteries. No bruits heard in any of the abdominal arteries. So while I'm here, I'm going to check for her femoral pulses, 2+, and they are 2+ bilaterally. I'm also going to check for some inguinal lymphadenopathy bilaterally, no inguinal lymphadenopathy. I'm going to percuss her abdomen for some, starting over here, in the area of liver dullness. So starting here, liver starts there, to there. So measuring that, the span of the liver is about 6 centimeters, which is normal. I'm getting good tympany everywhere. And this is the area of splenic dullness. Okay, now I'm going to do some light palpation, okay? Tell me if you have any tenderness anywhere. Any tenderness anywhere?
No.
So I'm going to do a little deeper palpation to feel for any organomegaly or masses. Any pain anywhere?
No.
Okay, so I'm going to have you take a deep breath for me, and I'm just going to feel for your liver here. And exhale. Coastal border of the liver felt. So I'm going to ask you to take a deep breath while I check for your kidney, your right kidney. And take a deep breath and exhale. Unable to palpate kidney. And again, take a deep breath and exhale. Also could not feel the left kidney. And so I'm going to check for your spleen here, okay? Take a deep breath for me. Unable to feel spleen either. Moving down to her legs. So the color on her legs is uniform for her race and with the rest of her skin. Her hair distribution is even. There are no masses, lesions, no redness, no bulges, no edema or swelling. I'm just going to feel on your ankles, and again, no edema. Any pain anywhere? Pedal pulses, 2+ bilaterally. Dorsal piatus pulses, 2+ bilaterally. Any pain as I move up your leg?
No.
Any pain in your knees?
No.
Okay, I'm going to move up here and I'm going to check for popliteal pulses. 2+ and 2+. Okay, and moving on up here, any pain?
No.
Musculature appears to be even. Can I have you bring your knee to your chest on one side? Okay, can you do the other? Now can you cross your ankle over your knee like you're sitting cross-legged? Good, can you do the other side? Okay, great. Now can you move your leg out and back in? Abduction, 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 abduction. Good range of motion in both knees and hips. So I'm going to go ahead and have you have a seat on the side here now for me. And we're going to check your deep tendon reflexes. Okay, if I could have you lay your hand. All right, I'm just going to check your brachial. Okay, and then this one. Good, great. Okay, so I'm going to check your knee now, okay? Just let your leg relax into my hand. Okay. And now going to the other side. Let your leg, okay. Great. Okay, I'm going to check your Achilles. If I can have your foot. Bend it up. Good. Let's check this side. Okay, that's great. Deep tendon reflexes are equal bilaterally. Okay, can I have you push back? Now push out. Great. And can you lift up against my hands? That's perfect. Okay, and now moving up here, so bilateral leg strength, and I'm going to have you do a shoulder shrug while I'm here. So that's spinal or cranial nerve 11, the spinal accessory nerve is intact. And can I have you push up against my arms, or put your arms up against my hands and pull down. Bilateral arm strength is equal and strong bilaterally. So just a few more tests. Can I have you touch your fingers to your thumbs? Great. Okay, and can you use your hands like this on your lap? Perfect. And can you touch your knee to your opposite shin? Good job. Okay, and if you don't mind, can I now have you stand up? And can I have you stand on one foot and then the other? Good. Great. Okay, can I have you turn around in front of me? Bend down and touch your toes. Normal spinal curvature, no scoliosis, kyphosis, or lordosis noted. So go ahead and stand up and bend back a little. So bend forward a little, and then, yep, great. Now can you bend side to side for me? Okay. And then can you rotate? And rotate the other way, great. And then can you put your heels together? Hands at your side, now close your eyes. No swaying noted. Okay, great. And now if you don't mind sitting down, I'm just going to check the strength and mobility of your neck. So if you could turn your head towards my hand, and again, good strength. And can you put your ear to your shoulder on both sides, one side and then the other. Put your chin to your chest and put your head back and look up. Any pain with any of that? Good range of motion to the neck. And can I also have you put your hands out, thumbs down, raise them over your head now? Any pain with that? Okay, good range of motion with that as well. Okay, and I believe that's all for our exam today. Thank you for listening.